Oh, looks like we're live already. Sure enough, it says start broadcast. All right, the first thing that we need to do is we need to go and turn on your screen share. Chapter 19, PowerPoint review. So let's start our screen share. There we go. Got it right there? Yeah, we do. Okay, on page 2 or slide 2 and 3. Okay, slide 2. Simply, you need to know serves as the principal weight bearing of the lower leg, or the bone, or principal weight bearing bone of the lower leg. Make sure you know which one it is. All right. Also, is the tibia the longest bone of the body? It tells you right there. The second longest bone of the body. Got me? Cool. All right, so we can mark that one off and that one off. Slide 3. Fibula. Is this the long, slender bone located on the lateral aspect of the leg? The lateral aspect of the lower leg. I don't know why I'm getting all of this. So, what's the next one? I'm going to ignore that. Main function of the fibula. There it is. Provide the attachment of muscles. Great. Also, all right, we talked about that too, the long slender bones. So, this slide here, know all of it. Let's go to number 6. Number 6, you need to know your anatomy. This is a fill-in-the-blank question, and it says, list 4 major ligaments of the ankle. Anterior talofibular, posterior talofibular, and calcaneofibular. If you spell this like some kind of jibber-jabber, I'm not going to take it. So it better be phonetically correct. Also, your deltoid ligament. Got that? That is fill in the blanks. Know how to spell them. It will ask you only to fill in the blanks. All right, true or false? The medial ligament of the ankle is the, well, there's only one. So know that. Where's your medial ligament of the ankle? On number there, 6. Oh, holy smokes, I screwed up here. We have to go back to 4. All right, number 4. Here's some more anatomy on slide number 4. True or false? The thickened distal ends of both the tibia and the fibula are known as the medial and lateral malleolus. Is that true or false? Well, if you read your study your stuff, you might have an idea. The medial malleolus bone extends farther than the lateral malleolus bone. All right? You'll find that out right there. Let's go to slide number 13. Slide 13. It's a lower leg test. Obviously, this is performed by squeezing the calf muscle. It is not a compression test. It is the Thompson test. You will have the option of compression test on that test on your tester. All right, let's go to number 15. 15. Blank is performed by squeezing the tibia and fibula together to check for fractures of the tibia or fibula. So, you need to know that one. Let's go to 16. Slide 16 looks like this. Ankle stability test. With the anterior drawer test, and there's a clunking feel, is that a positive test? There's a clunking feel or sound, is that a positive test? True or false? You need to review that. Use to determine. All right, positive is a clunking sound or feel. Let's go to number 18, ankle stability test. Used to determine the extent of inversion and eversion injuries with the foot positioned at 90 degrees to the lower leg and stabilized, the calcaneus is inverted. All right. Is that Thompson, Taylor tilt, compression, or anterior drawer? You know what it is if you read your notes. True or false? The Taylor tilt test is used to determine the extent of injury of the plantar flexion and dorsiflexion injuries. Do you think that's right? True or false? The Taylor tilt test of the ankle is used to determine, here it is right there, of what kind of injuries. Let's go all the way down to 25, which is right there. It says ankle fracture. In most cases of a fracture, swelling and pain may be extreme. There may not be any deformity, but if a fracture is suspected, splinting is essential. That is common sense. All right, if you suspect a fracture, it is essential. All right, let's go to number 35. 35 looks like this, the anterior tibialis tendinitis. All right, so increased activity and increased heel work. Ice packs coupled with stretching. These are how you take care of it. All right, is that how you take care of anterior tibialis tendinitis? All right. Remember, you need to know if it's increased or decreased activity. Let's go to 36. We just passed that little bugger. There he is. Perineal tendinitis. Remember Jose? Complains of pain behind the lateral malleolus when rising on the ball of the foot during jogging, running, cutting, and turning activities. Tenderness is noted over the tendon located at the lateral aspect of the calcaneus distally to beneath the cuboid bone. These symptoms are of, there you go, perineal tendinitis. What about number 38? MTTS, medial tibial stress syndrome, commonly known as, there we go, MTTS. Is that true or false? Okay, let's go with 42.
He's kind of busy.
42 is, remember I talked about this. We don't place a compression wrap on anterior compartment syndrome. Do not do. So, put that on there. Oh wow, here's a nice little, here's your other listing question. Last slide of your notes. List 4 of the 6 rehab treatments for the ankle and lower leg listed in the notes. Make sure you've got your, you can use any of these. All right, so that's 4 out of 1, 2, 3, 4, 5, 6, 7. 4 out of 7 is pretty easy to do. Now, you're also going to have to do these, which is going to be on number 9 and 8. 8 and 9. 8 and 9. You need to know your compartments. Your anterior compartments, lateral compartment, superficial posterior compartment, and deep posterior compartment. What you're going to have is you're going to have what it contains. And as you see on your slides, what each one of those contains. It will only have this portion of it. Beneath that, it's going to be matching, and it will have the names of the compartments. You must match the names of the compartments with their definition. So those will be 4 questions for you to do on that. On 19 through 21, slides 19 through 21, you're going to know about the symptoms and the treatments of ankle injuries. And it's matching again. So you're going to have A, B, C, D, E, F. All right? And then underneath, it's going to say grade 1, grade 2, grade 3, ankle sprain. You're going to put 2 of those letters to go with grade 1, 2 of those letters to go with grade 2, and 2 to go with grade 3. And you'll need to know the symptoms. So there, first is the symptoms, followed by the treatment. Remember, as we said in class about whether it is mild, moderate, and severe. Also, you need to know about full weight bearing, non-weight bearing, etc. So those will be your other matching questions, and that is all you need to know for your test. I think you'll do fine. It's a lot of information, but you better study for more than just 2 hours and one night. Adios.